Welcome to Anatomy and Physiology Made Simple. I am Dr. Aditi, and today we're going to be talking about anatomical positions and directional terms. We will be covering a lot of information in this video, but specifically by the end of this video, you should be able to describe human body using directional and regional terms. You should be able to identify at least 3 planes most commonly used in anatomy and distinguish between anatomical regions versus quadrants and list the types of body movements and everyday application. So let's get cracking. So I know what you're all thinking. You're like, why on earth do we even need a whole new language for anatomy and physiology or in healthcare? Is it really that serious? Well, it actually is. The research shows that having this universal language and terminology, what it does, it increases precision and it reduces medical errors, simply because it takes away any ambiguity. There's no guessing involved, right? There's no, I need more clarification. It's very linear, it's very direct, and you should be able to understand it without needing to go back and revisit the topic. That's the whole point. And if you can do that, that reduces medical errors and improves patient outcomes, which is what we are eventually all about. So having a universal terminology is very important, and the more precise it is, the better it is. So let's take an example here. On the screen, you see a scar on the on the hand. You might say, I have a scar above the wrist, and that would be quite adequate in everyday conversation. However, if I am a nurse or I'm a therapist or whatever, I'm doing some other procedure, I would need a lot more information because the scar above the wrist is too vague. I'd go, okay, it's above the wrist. Is it like 3 inches away? Or is it, on the radial side or on the ulnar side? Where is it? I would need a lot more information. I'll give you an example. I used to work in hand therapy where I would fabricate splints for patients who had hand injuries or surgeries. And if a doctor left me a note saying, please fabricate a splint for patient X, I would need a lot more information than, avoid the incision or scar on the back of their hand. Like, I would need a lot more information. And so in that scenario, typically a doctor would be a lot more precise, and he would probably use terminology like this. Please fabricate a splint for patient X, and avoid the incision or scar that is located on the dorsum of the hand, located on the radial side, superior to the carpal bone and inferior to the second MCP joint, which is exactly the location of the scar, using medical terminology. Now, because we use this language, there's no guessing. I'm probably going to get that splint correct. However, if he gave me a vague response and say that this patient has more than one scar, more than one incision that needs to be avoided, that's going to cause a few problems, right? I'm going to have to go back and talk to him. So anyway, regardless, that's a very simplistic example, and it's not a grave scenario. But as you can imagine, if we don't have clear language in healthcare, it can impact things to a very grave degree, and that's why it's so important. All right, well, let's start with directional terms. In order to further increase precision and clarity, what anatomists did is they decided to standardize the human body. And why? Because the human body has so many myriad of planes that it can be in, right? It can be in this direction, that direction, and we've got so much motion and fluidity involved. When I'm talking about, the anterior surface of the human body, how do you know what surface it is? Because it would depend on what position that body is. So the anatomists, what they did is say, let's standardize a specific position of the body, much like the map of the world. When you look at the map of the world, it all looks the same. Like, north is always going to be facing up. They've standardized that so it all looks the same no matter where you read the map, which country you're in or where you are. Same thing with the human body. What anatomists did is they standardized a specific pose, which is called the anatomical pose or the map of the human body. And this anatomical position is standardized. So whenever we're talking about the human body, this is the reference point. And the anatomical position is that where the body is standing upright with feet at shoulder width, parallel, toes facing forward. Also, the person is looking forward, their arms are by their sides laterally, and the hands or palms are facing forward. So this is the anatomical position, and it's standardized so that it reduces any confusion across the globe, right? Now, let's take an example here. Let's say that this person has a scar in the anterior, which would be the front, a carpal wrist region. So this would be right here, right? Now, this is present on the palmar side of the wrist. However, because the anatomical position is always the reference point, the term anterior would still apply if this mannequin's hand was turned over like this, palm facing down. I would still say the scar is in the anterior region because the reference point is the anatomical position. That is the standardized map of the human body that we need to refer to. So just remember that. Because it can really help you out when you are describing terminology. All right, let's take a look at some specific terms. I'm going to start with the term superior, and I like to use the crown for this because I think about the queen and how she considers herself superior. So she wears a crown on her head, so it tells you superior is going to be up here, and she sits above everyone and considers her subjects or peasants, below her, and they kiss her feet. So they are inferior because they're sort of down here. Okay. And then we've got anterior, which most of you know, but obviously if you think about anterior, one strategy is to think about looking down at ants. That's going to be anterior. It's going to be in the front and down sort of area, right? Cranial is going to be towards the head. Caudal is the tail end. Medial is going to be the middle of the body. Lateral is on the sides. And then one that is often, a bit tricky for people is proximal and distal. And if you're in rehab, this is one that's commonly used. Proximal means proximity, which means it's closer to the core, and distal, just like the name suggests, is going to be distant from the core, right? So your fingers are going to be in distal plane, whereas your shoulder is more proximal to the body. So again, you're going to use these type of words to describe position of the human body. Oh, one more I forgot to mention. Anterior is also called ventral, and posterior is often called dorsal, and you'll see those words interchangeably used. Okay, so now we're going to talk about anatomical regions. So there's several regions, and I know that, a lot of them you already know, so I'm going to go very fast in this slide. However, there are certain ones that I will point out that are often overlooked. So let's just get started here. First is the cranium, obvious. Frons is here. We don't always think about it, but that is one that's overlooked. Oculus makes sense, right? Oris, bucca. Now, some of these terms you need to know because they're actually going to be part of the nomenclature around muscles. Bucca is one of them for like buccinator, for example, right? Oris is going to be around your mouth. Mentis is your chin. Cervicis is the neck area. Axilla, I think you probably know, is your armpit area. Brachium. Then we've got the thorax. Mamma, which is going to be your mammillary area, abdomen, umbilicus, hypocoxal area, pelvis, inguine, and pubis area. And then one on the inside is going to be your antecubitus. That's the inside of your elbow. And that's one that's often overlooked that people don't recall. Okay, let's look again at the anterior view, but the lower part of the body. Antebrachium. So we had brachium up here, and then we have antebrachium lower. And then we've got carpus, which is your wrist area. Pollex. Now, this is one that people don't always think about. That's going to be your thumb. Palmar, makes sense. Digits or phalanges. And then manus is basically your whole hand. Patella, crus, which is going to be the front where shin guards. Tarsus and hallux. Hallux is going to be your big toe. And that is all called pes, which is the foot. Now let's look at the posterior view. We've got the cephalon, acromial area, which is your shoulder, dorsum, olecranon. So remember we had antecubitus and now we've got olecranon. Then we've got lumbar, sacrum, gluteus, which everyone seems to know, femur, popliteus, sura, that's your calves, calcaneus, and plantar. So I would just suggest memorizing these. Take various pictures or models or labeling diagrams. Don't just stick to one. It's really important that you can generalize it to other pictures. So just take a random picture in a magazine or even a cartoon character and see if you can label these regions, because they do come in handy in the healthcare world when you are discussing terminology and patients. So the first set of anatomical terms we need to talk about are body planes. Now, why is it important to know all these body planes? Well, the reason is a lot of what we see in healthcare, especially if you're looking at CT scans or MRIs, for example, you need to know what angle that purview is from. You know, was it a cross-sectional across the board? Was it longitudinal? Like, what direction am I looking at? Because that's going to give you spatial context, right? So it's really important to know that. But other than that, body planes are very important for movement analysis, which you're going to see further on. So if you're going into the rehabilitative context, the body planes offer us a lot of information about our overall movements. And again, I'm going to explain that further later, but let's just talk about these planes to start off. The acronym I use is called SOFT. S is for the sagittal plane, O is for the oblique, F is for frontal, often called coronal, and then T is for transverse plane. So these are your standardized planes. Let's go through them one by one. So sagittal plane, this actually cuts the body into left and right sections. So it goes from the top all the way down, and you've got left and right. Now, it's a little bit tricky because if it's right in the middle and there's equal left and right, then it's actually called the mid-sagittal or median plane. However, if that sagittal plane is skewed just a little bit, where there's more on one side versus the other, then that is actually called the parasagittal or, wait for it, longitudinal plane. So just to add a little bit more color to your terminology, those are some other words that are used. So that's the sagittal plane. And I like to use my hand because whenever possible, if you can use kinesthetic learning, that's really going to enhance your mastery of the subject. And you always have your hand. So anytime you can use your body, it's a great trigger and prompt for you to recall something. So when I think about the sagittal plane, I take my hand and I go straight to the middle. Mid-sagittal, parasagittal. That's how I remember it. Okay, moving on, let's go to the oblique plane. Now, this is one that is often not talked about. It actually occurs at an angle through the body. You might see this more in histology, or you might see it in MRI or CT scans. So it's not used very often, but it is something you need to be aware of. And again, it's at an angle. So now let's move on to the frontal or coronal plane. This is going to be your front and back. It divides the body into this front and back. So again, take your hand and you're going to put it on your head like this, right? Like it's a crown sitting on your head. And that divides the body into the front and back half. So remember, this is not just for your body. This can be applied to organs, right? Like I mentioned in CT scans and MRI scans. You know, is it a sagittal or a frontal dissection? That's what we need to know. Okay, then we've got T, which is a transverse plane, which basically chops the body into half, like in your waist area. Think about your navel and getting chopped here, and then, bending forward. That's going to be your transverse plane. And that divides basically the body or organ horizontally into upper and lower parts. And transverse planes produce images often referred to as cross-section specifically. So that is often interchangeably used. All right, this is a bird's view of the planes. The reason I included this in here is because, when we learn new material, we tend to get stuck on a specific image that we learned from. And it's really important to have more spatial awareness around these diagrams that you learn in textbooks, because the body is not linear, right? It's not just on paper. It's a 3D, very fluid, motion-filled model. So you need to understand these planes from different purviews. And in this example, you can see at the top of your head, you've got the coronal plane, which is going to chop your head right in the top. And that is dividing the body into the front and back. And then we've got the median plane, which would be your mid-sagittal plane, because it's dividing the body into equal halves. And then you've got the sagittal plane, which is askew a little bit. Now, it doesn't have to be on the head. It could be on the shoulder, for example. So I just wanted to give you a different purview of anatomical positions, so you're prepared if you see it in a different context. So here I have a kinesthetic learning activity for you. As you can see, the frontal plane is represented by the red card, and it slices the body into front and back portions. And then there's a slit in the middle, which is going to house the green card. And the green card is the sagittal plane, because it's dividing the body into left and right parts. And as you can see, it's dividing it into equal parts, so it's actually going to be called the median plane, right? So just remember, the criteria is left and right parts, but if it's, equal parts, then it's going to be the median plane. Okay, and then lastly, we've got the transverse plane, which is quite easy, because what it does, it divides the body into top and bottom halves. And there you have it. There is a great kinesthetic learning activity. If you're a hands-on learner, or if you need that sort of visual spatial element, this can be super helpful for you. So I would definitely suggest giving a go and trying it out. All right, so now that I've sort of explained these terms to you, what you need to remember is this is how it works. You read something in textbooks, so you practice it, but if you don't use it, what happens? You lose it. This is why everyday application is so important. If whenever possible you can recall things that you've learned and apply it, that's going to reinforce your learning, and it's going to increase the mastery of that content or the subjects. So I just wanted to give you an example here. If we just learned about the frontal plane, next time you're chopping an apple, think about the directionality of that cut, right? That is the frontal plane. However, an orange is very different. It's a transverse plane that you're cutting the orange in. Next time you take your dog for a walk, think about what plane you're moving in. What plane are your legs moving in? That's going to be your sagittal plane. So do you see how you can really incorporate what you learn into everyday activities? And it's so important for you to do that to really enhance your learning and master concepts. Okay, now we're going to talk about anatomical axes. So we talked about planes. Now, there are two things with planes, right? It can be how the body is dissected or cut, but it can also be how a plane where we move, like the movement is occurring in a specific plane. So it's a little different, and it might take a little bit of sort of breaking down in order to understand this. So let's take an example of this person right here, or the skeleton, I should say. He is bending forward, which is flexion, and then extension. So anytime a movement occurs, what you want to ask yourself are actually two questions. What plane or direction is the movement occurring in? And what axis is the movement around? So those are the two things. Now remember, anatomical planes are not just how the body's cut. It is a plane where movement can occur. So it might take a bit to wrap your head around this, but let's do it together. So you saw this person flexing and extending at the torso. Let's analyze that. So in flexion and extension, what happens is we need to figure out the plane that the movement is occurring in, and then we also need to figure out the axis. So the plane is going to be the sagittal plane, right? Because you're moving this way. So think about that piece of paper that you saw in the craft activity, right? The green one, you're moving in that plane. So that's actually going to be your sagittal plane. Now, in order to figure out the axis, what you'd have to do is figure out what is it moving around for that motion to occur. So if you took a pole from the left side and through the midsection, through the waist and to the right, that would be called the medial, lateral or transverse axis. And that's what flexion and extension movement is around, right? Does that make sense? Because again, it's a little bit spatial, right? You have to sort of think of it in a spatial standpoint. But let's take another example. Let's take a longitudinal axis, and we're going to discuss rotation here. So in rotation, what plane are you moving in? Think about rotating. What plane would that be? I hope you guessed it. Yes, it is the transverse plane, right? Because it's happening in this sort of plane, which is the plane that sits right here, the transverse plane. But what about the axis? Well, again, it's what does it move around? So here you'd have to stick a pole from your head down through your body. And the axis is called the longitudinal axis. And that's what rotation is moving around, right? Okay, now let's look at lateral flexion. Let's see what plane and what axis that would be in. So let's talk about lateral, which would be this, moving side to side, like bending on your waist area. So what plane is that? That would be frontal or coronal plane, right? So I moved in this sort of direction. Now, what about the axes? Well, what is it moving around? You would have to put a pole through your navel and through the back. That would be the axis. That's what it would go around. So let's take a peek here, right? When you are doing this, you are actually rotating around the antero-posterior axis. In summary, here we go, flexion extension, the axis is going to be medial-lateral and the plane is going to be sagittal. Then we've got rotation where it's the longitudinal axis, right, goes from your head down, and it's going to occur in the transverse plane, right, this plane right here where you're doing rotation. Lateral flexion is happening in the antero-posterior axis, remember, through your navel and back. And then it is also occurring in the frontal plane. So that's just a brief sort of identification of movement analysis using axes and planes. Now, it is really important that you actually try this out. Like if you're in a study group, try it out with somebody. Have them do rotation and assess the planes and the axes, because that's really going to help you visualize it, especially if you're going into any sort of rehab related field. So we've discussed sort of the anatomical planes, axes. Now we need to sort of hone down and get a little bit more specific and precise, specifically in the abdominal area. Why? Because a lot is going on in there, right? You've heard the whole adage of, go to see the doctor and say, I have a pain in my abdomen. Yeah, but where? And what does it involve? Because there's so much going on in your abdomen. There's so many organs sort of compact and tightly packed in there. It is a very concentrated and complex part of real estate on the human body. So we need specific language for specific areas in the abdomen so that we can have clarity and concise communication. And that's where the regional areas come in and the quadrants come in. I don't know why, but some parts of the world, they use quadrants. Some parts of the world, they use regions of the abdominopelvic cavity. Now, what I would suggest you do is learn both, and then also learn to use them interchangeably and superimpose them on each other so you know which quadrant aligns with which region. But let's go through this. The regions are actually 9 of them, and the quadrants are actually only 4. So let's go over the regions first of all. And they're quite easy to understand and label once you sort of have it down. So I always start with the umbilical region, right? Your navel area. That's fairly self-explanatory. And then above that is your epigastric, which basically translates to above the gastric area. So that would be right above, and then below, makes sense, would be hypogastric, because hypo means under, gastric is your digestive area. So we've got umbilical, epigastric, hypogastric. And then let's just take the right side. Then you've got directly next to the umbilical region, you've got the lumbar region, and that makes sense, right? You've seen lumbar supports, things like that. You know that's sort of the lumbar region. And then below that is going to be the iliac region. That's your pelvis area, essentially. And at the very top is your right hypochondriac region. Now, the nice thing is the right side mirrors the left. So once you know one side, you know the other side. So fairly easy, you just have to practice it. And then quadrants are super easy because there's only 4, and it's basically just dividing into quarters, and you label them exactly in their position. So right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Now, you do need to know these regions, undoubtedly. But what you need to know more precisely is what is contained in these regions, right? So you have to memorize that the epigastric region, we've got the liver and the stomach, part of the stomach, right? Now, if you superimpose the quadrants on there, you'll know that the right upper quadrant has part of the right hypochondriac region. It's got part of the epigastric region, umbilical, and lumbar, right? So you have to know both. Now, I'm going to show you a quick little strategy on how to memorize it or learn it. Again, it's more of a kinesthetic approach if you like that sort of thing. Okay, here we have it. All you need is a piece of paper, and it's somewhat like origami. You're going to fold that piece of paper, just an 8 by 11, fold it into thirds, equal thirds if you can. There you go. And make sure those creases are nice and solid. And now what you're going to do, you folded it horizontally. Now you're going to fold it into thirds again, but you're going to do it vertically. So you can turn your paper around and fold it vertically. And again, make sure those creases are nice because you're going to need those creases to help you align things. Okay, open it up. And now you've got yourself a grid, right? That is a grid with 9 boxes. So those are going to be your abdominopelvic regions. And then just start labeling those. So really easy. Of course, you've got the hypochondriac or hypochondrium. Some textbooks will label it that. And then you've got the epigastric region. And that's also going to be the hypochondrium. It's just going to be on the left side. And then, I always start with the umbilical. Actually, that's what I always start with. I don't know why I didn't do it here. And then you've got the hypogastric, which is under the stomach or digestive area. Lumbar, right? and iliac. And of course, the right side is a mirror image of the left. So once you know one side, it's fairly easy to figure out the rest. But you're not done here, right? What you want to be able to do is be able to visualize both the quadrants and the regions together, because you don't know what the communication is going to look like. Whether they're going to say, oh, in the right upper quadrant, or if they're going to say in the right hypochondrium area, you don't know. So you should be able to visualize both. So what you will do is take another marker and then draw a line dividing that piece of paper into quarters, a horizontal and vertical line. And now you have your quadrants. There's going to be the right upper quadrant, your left upper quadrant, and then of course the lower quadrants too, respectively. But now you can see which parts of the regions overlap with the quadrants, which is very valuable information. But what's even more valuable that's not shown in this video that I would do next is I would either draw or write the different organs in each region, because that's going to help you more. It's going to help you really visualize, okay, the hypochondrium, right hypochondrium has the liver, has part of the stomach, blah, 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 blah. Like that's going to be really important. And then you think about it, when you go to the doctor and you say, I have pain in my abdomen, and they say, where? And you show them a spot, immediately they go, okay, that is the, iliac region. And, I know that the large intestine is there, and I know that the appendix is in that area, so maybe I need to rule out appendicitis, right? That's sort of how those regions are assessed. But also, if I have a patient as a therapist who has pain in a certain area, I might call the doctor and say, hey, I've been treating Miss So-and-so for this, and she is complaining of pain in the left hypochondrium area. I just wanted you to be aware of it. Again, that clean, clear, concise communication is going to be so helpful. Okay, we're going to talk about body movements. And I know you're probably like, oh, that's too simplistic. And yes, it probably is. You probably know all these, but I just want to be very thorough with this presentation and make sure that I'm addressing everything and that there is clarity around these. So flexion obviously is bending. Technically, it's actually decreasing the angle between two body parts. Then we've got extension, which is the opposite, where you're increasing the angle between two body parts. Abduction is going to be away from the reference axis. Now, this is going to be a bit tricky. So abduction is going to be, if your reference axis is the anatomical position, say the middle, then abduction would be moving away from that, right? It would be like my arm moving away. This is abduction. And adduction would be coming towards the reference axis, which is the median. But your reference axis could be in your hand. So let's just say this middle is my reference axis. And abduction here would be spreading my fingers apart. Abduction. Adduction, on the other hand, would be going towards the reference point, right? So just remember, you do need to have some clarity over the reference axis. Protrusion is like sticking your tongue out or forward, and retrusion would be pushing it back in. Elevation is like, when you elevate your shoulders. Superior to the reference axis is what you're doing. Superior, remember, is up, so you're moving in the superior direction. Depression is going to be inferior, and then lateral rotation is going to be away from midline. So let's say this is lateral rotation. I'm moving away from midline. All right, medial rotation is going to be the opposite. You're going inwards towards the midline. Pronation is going to be palm down. Just remember palm down and P for pronation. Supination is palm up. Circumduction has a lot going on, like you're moving your, you're moving your hand all the way around. Deviation, this can be ulnar or radial. So this typically, let's look at our wrist here, right? You can have ulnar, this is the ulnar side and this is the radial side. Ulnar deviation would be moving abduction of the wrist, so moving away from the reference point in the ulnar direction, so like this. However, radial abduction of the wrist would be in the other direction, right? It's abduction because it's moving away from the center of reference and it's going towards the radial or the thumb side. So that's radial abduction of the wrist. Okay, opposition is going to be this, and then reposition is going to be this. Inversion, let's pretend my hands are your feet. Inversion is going to look a little bit like this, and eversion is going to look a little bit like this. So in inversion, the plantar side is turning in towards the medial, and in eversion, the plantar side is away from the medial plane. All right, again, I know you're going to be like, oh, she's just banging on about this. If you want to truly master the concepts, you have to use them. Movement helps with mastery because your body remembers and you always have it with you. So it's a great prompting tool. So next time you are going to yoga class, think about the planes that you've discussed today. What planes are you moving your body in? That's a great review. And then let's just say you've decided you're going to wash the dishes later on that day. What body movements are you using? Think about, am I pronating? Am I rotating? Abduction, flexion, extension. If you can do that, it's really going to help solidify those concepts in your mind, and you will truly be able to achieve mastery. All right. As usual, I always like to end with a mind map. And the reason is the mind map, especially in anatomy and physiology, when there's so many little rabbit holes of information, a mind map can give you this sort of bird's eye purview, and it can be so profoundly important because it sort of gives you a map of how things relate to each other, right? Because we can get so hyper-focused on directional terms, but how does that impact reference axes? How does that impact anatomical planes? That's why mind maps are so important. Now, mind maps are also brilliant for a precursor to active learning and writing, right? I'm sorry, not active learning, active recall. So, they say the whole point of mastery, when you've mastered a concept, you should be able to write it out without your notes or any references. You should be able to explain it to somebody. That means you've truly understood the concept. Well, mind maps are sort of a precursor to that. So I always try to include them. They're really good to get the bigger picture and to really make sure you've got all those pieces coming together that you've learned. So here in anatomical terms, we've got the reference axes, medial, lateral, anterior, posterior, and longitudinal. And then we've got directional terms, which there are a plethora of them. The few that we didn't talk about is deep and superficial. Superficial obviously is very close to the surface, and deep is going to be way inside the body, away from the surface. And then anatomical planes, we've got the sagittal, frontal, and transverse. But under that, I've listed the movements that occur in those planes. So that's going to be really important. And if you wanted to, you could add down there the axes that are involved in those movements. So it can be a really good study tool to create mind maps like this. But I'm going to leave you with something else. So we've gone through all these concepts, and in order to further enhance your learning and to really enforce what you've learned here today, I have created a little workbook which has crosswords in it. It has fill in the blank, and it also has a template for mind maps, because all those activities get you moving and thinking about the concepts that we've learned today, so you can practice them in a different way and really enhance your learning. If you're interested, that is available on my website. Okay, I'm going to leave you with Ollie, who's going to share a riddle with you to kind of assess, what you learned today. And I will see you next time.